Hello, everyone. My name is Nile Bostic, and today I will be presenting to you my personal philosophy of health education and promotion. Before I introduce my philosophy, I'd like to share a bit about my background in health education, as it provides a foundation for my future aspirations. During my undergrad years, I interned as a quality improvement specialist at a catastrophic brain and spinal cord injury rehabilitation facility, where I served to enhance various aspects of the health care across all of the center's departments. I more recently served as a registered behavior therapist, or RBT, for children and young adults who are on the autism spectrum and or have cognitive or behavioral impairments. For a few years now, I have also been certified as a health education specialist, or CHES, and over those years, I've dedicated myself to educating individuals in my family and community about health management and preventative measures. I also served as an elementary STEM instructor and have recently taken on a full-time role as a direct care professional at a prescribed pediatric extended care facility, or PPEC. These experiences combined have allowed me to implement my teachings among youth of various demographics and backgrounds, fostering a greater personal awareness of differences in learning styles and a passion for educating. Looking ahead, my goal is to serve as a full-time patient advocate. I aim to use my diverse experiences to support patients by ensuring their voices are heard and their needs are met. In order to reach my goal of becoming a successful patient advocate, I must focus my actions on promoting good health. At the heart of my personal philosophy is the commitment to consideration, communication, and compassion. These three elements are essential in driving impactful health initiatives in our community and healthcare settings. To emphasize the importance of these three aspects of care, I will further discuss three supporting actions or objectives that may help to convey their application of value to my philosophy. Those actions are to 1. Improve cultural competence and acceptance, 2. Promote beneficence through empowerment education, and 3. To facilitate better communication between patients and providers. I will ensure cultural competency among hospital staff. For instance, I will personally lead and oversee trainings offered to employees geared toward enhancing cultural competency. It is important that staff are aware and accepting of their patients' cultures and personal values in order to provide patient-centered and effective care. Some ways that I will implement this are through cultural awareness workshops and trainings, competency checks, and cultural recognition activities. I will promote beneficence through empowerment education. For instance, I will encourage patient-centered care by empowering patients and staff with the knowledge and skills they need to advocate for themselves and others. Providing this will make both patients and staff more confident in making decisions regarding treatment plans and general aspects of care. Ways to implement this would be regularly conducting patient needs surveys, creating health information for various mediums and channels, and offering advocacy skills trainings for both patients and staff members. I will foster improved communication between patients and providers. For instance, I will bridge communication gaps between patients and providers by helping patients understand their treatment options and health risks. Understanding their health and care choices will help them make informed decisions that can be effectively communicated and established with care personnel. Ways to implement this include providing educational pamphlets to patients who are interested in improving their knowledge of medical jargon, establishing meetings or consults with both parties present, and through encouraging the use of telemedicine resources from remote settings. As I conclude, I want to emphasize my belief that patient advocates bridge the many gaps in care, compassion, and communication that exist between patients and providers. In order to fill these gaps, we must foster growth among those principles. I will personally guide patients and hospital staff toward better health by implementing program initiatives that improve cultural competence among staff, ensure beneficence and standards of care, and facilitate better communication for all. Thank you for listening to my personal philosophy of health education and promotion.